Diabetes. Frequently asked questions. What are the common names by which diabetes is known? Medically, the common variety of diabetes is known as type 2 diabetes or T2 diabetes or diabetes mellitus type 2. How common is the problem of diabetes? In India, there are about 60 million people with diabetes. By 2030, there will be a minimum of 100 million cases with diabetes. In addition, there are about 77 million persons with a very good possibility of developing diabetes sooner or later. This is known as pre-diabetes. World over, the number of people with diabetes rose from 180 million cases in 1980 to 415 million cases by now. There will be a minimum of half a billion cases, that is 500 million cases by 2040. The prevalence of diabetes has been rising more rapidly in low and middle income countries than in high income countries. This is mainly because food is a cheaper luxury than bicycle, car, gold, or other expensive items, including house. People of all ages in these countries tend to overeat because it supplies a very basic fact of human nature, namely pleasure. Children, men and women, eat all sorts of foods, not only for satisfying basic hunger and over and above for human pleasure and satisfaction, that is more than their need. They tend to be completely oblivious of the fact that the human body has no means of expelling the extra food that's swallowed. In other words, the extra food, if not used up by extra exercise, is not expelled in the feces, but is unfortunately absorbed and stored as fat in fat deposits all over the body. And this is the main reason for obesity starting from early childhood. Our cultures, in all strata of society, inculcate the habit of overeating very early in age, mainly by mothers who tend to force feed their children throughout the day at the least excuse. In a few years, the young population ingrains a habit of overeating at the least excuse. Preventing diabetes. Briefly, a healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco use are ways to prevent or delay the onset of diabetes. To delay or avoid the consequences of diabetes, use mainly wholesome cereals, preferably not refined wheat or refined rice. Physical activity, medication under the guidance of your doctor, and regular screening, that is general checkup of body, and treatment of complications. An overview of diabetes mellitus type 2. More on diabetes and insulin, see Diabetes 1 video. Diabetes is a neuroendocrine disorder, most commonly occurring in middle-aged persons due to lack of sufficient insulin produced by the body, or the body's tissues are not sensitive to insulin. What is the role of pancreas? Insulin is a hormone produced by the pancreas, a 15 centimeter or 6 inches long organ located behind the stomach, embedded horizontally across the abdomen. Pancreas, in addition to insulin, produces digestive enzymes, lipase to break down dietary fat, protease to break down larger molecules of protein to simpler amino acids, and amylase to break down large polysaccharide molecules called sugars, that is starches, into simpler sugars, chemically called monosaccharides, which is used for energy production. Pancreas has two major types of tissues. One, the acini, secreting digestive juices into the intestine, and two, islets of Langerhans, secreting insulin directly into the blood. Pancreas has 1 to 2 million islets of Langerhans. Each islet is 0.3 centimeter in size and are close to the capillaries, the smallest blood vessel in the body, into which it secretes insulin. The islets contain three major types of cells: alpha, beta, and gamma. The beta cells constitute about 60% of islet cells and they secrete insulin. Dietary contribution in different populations. There are only three types of foods we take for our health needs: carbohydrates, proteins, and fats. Other food substances are also essential: vitamins, minerals in small quantities, and of course water. Types of foods. The average dietary contribution of carbohydrates, fat, and protein in diets in different populations. Western diet: carbohydrate 48%, fat 35%, and proteins 17%. Eastern diet, including India: carbohydrate 75%, fat 15%, and proteins 10%. Dear listeners, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital e-prescriptions, available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast repertoire of more than 100,000 prescriptions. How to diagnose type 2 diabetes? Usually, patients are middle-aged and overweight. Nowadays, because of overeating, the obesity is common in children and some of them have type 2 diabetes. Diagnosis of diabetes by oral glucose tolerance test, that is oral GTT. After overnight fasting, blood glucose is measured. An adult person is given 75 gram glucose dissolved in 300 ml water. For some, plain glucose drink may induce a feeling of nausea and may vomit. A dash of lime juice mixed in glucose drink may help to avoid this situation. For children, 1.75 gram per kilogram is the glucose dose for the test. The glucose drink is taken within 5 minutes. Rest is recommended during 2 hours after drinking glucose drink. Avoid any exercise during this time because it may interfere with the result. Measure blood glucose 2 hours after the drink. Normal blood glucose tolerance. That is, fasting level should be below 100 mg per 100 ml. Hemoglobin A1C should be below 5.1. At 2 hours after glucose drink, the blood glucose should be below 140 mg per 100 ml or hemoglobin A1C below 6.5. Note, 100 ml is denoted as deciliter DL, that is 1/10 of a liter. Hemoglobin A1C, for explanation, see below. Impaired fasting glucose, that is IFG. Glucose level 100 to 125 mg per deciliter, that is in millimole per liter between 5.6 and 6.9. 1 millimole is equal to 18 mg of glucose. Hemoglobin A1C correspondingly measures 5.1 to 6. Impaired glucose tolerance. Impaired glucose tolerance, 2-hour glucose level is between 140 to 199 mg per deciliter. That is, hemoglobin A1C is between 6.5 to 9.6. Note, the higher the 2-hour plasma glucose within this range, that is between 140 to 199 mg per deciliter of impaired glucose tolerance, the greater the risk for microvascular abnormalities, that is small blood vessel abnormalities. Pearls. Diagnose diabetes if fasting blood glucose is 126 mg per deciliter or 2-hour glucose is more than 200 mg per deciliter or hemoglobin A1C is more than 6.5. Important. Do not diagnose diabetes on the basis of 1. Hemoglobin A1C results alone. 2. Don't test capillary plasma glucose, that is the finger prick method, and only test on venous blood glucose. 3. Urine dipstick test. What is hemoglobin A1C? Hemoglobin A1C estimates the amount of glucose attached to hemoglobin, that is a protein in the RBCs in blood, essential for carrying oxygen from the lungs to tissues. Hemoglobin A1C measures the average blood glucose level over the past 3 months. Normal level is below 5.1. Pre-diabetes between 6.5 to 9.6 and diabetes above 9.6. Status of beta cell function in diabetes. By the time diagnosis of diabetes is present, around 40 to 50% of beta cell function is already lost, with a further progressive loss of 4 to 5% expected each year thereafter, regardless of oral medication used. Status of impaired glucose tolerance. They are already near maximally insulin resistant. They may have lost as much as 80% of their beta cell function. 10% of them have diabetic retinopathy. Retina is the layer of tissue in the eye which captures the images entering the eye and sends the impulses electrochemically to the brain for further processing. For all these reasons, these patients should be considered to have type 2 diabetes and treated as such. Hence, eye testing, lipid profile, urea and creatinine, that is the kidney function tests, should be tested in these patients. Further deterioration of beta cell function causes failure of oral anti-diabetic drugs to maintain blood sugar at the desired level and the need for insulin therapy. Normally, increased insulin levels in the blood, a situation common in type 2 diabetes, should suppress appetite centers in the brain. But obese people continue to overeat, indicating that the appetite centers in the brain are also resistant to insulin. Home truths: no single oral agent or a combination of agents prevents progression of type 2 diabetes. By delaying the decision to start on insulin therapy, the hyperglycemic burden due to less than ideal hemoglobin A1 levels leads to diabetic complications. Starting on insulin therapy earlier during treatment provides tighter glucose control than oral treatments. 2. Relieves and spares beta cell function. 3. Helps lower insulin resistance. 4. Reduces lipotoxicity and glucotoxicity as explained earlier. 5. Decreases liver production of glucose. And 6. Improves body's own beta cell function. Other actions of insulin. 1. Insulin is anti-inflammatory and antioxidant. 2. It may contribute to protection against abnormal function of endothelium, that is the innermost lining of the arteries. Starting insulin therapy earlier during treatment provides 1. Tighter glucose control than oral treatment. 2. Relieves and spares beta cell function. 3. Helps lower insulin resistance. 4. Reduces lipotoxicity and glucose toxicity as explained earlier. 5. Decreases liver glucose production. And 6. Improves beta cell function. Insulin is also anti-inflammatory and antioxidant. It may also contribute to protection against endothelium, that is the innermost lining of the blood vessels. Diet in diabetes. The proportion of different kinds of foods should be carbohydrates 70%, proteins 20%, and fats 10%. Fibers from plants are a very useful addition to diet, like cellulose, gum, and pectin. They slow glucose absorption. Soluble fiber, as in beans, apple skin, and cereals, may have a favorable effect on body cholesterol. Insoluble fiber, such as cellulose and hemicellulose in bran, decrease intestinal travel time of food. Carbohydrates. Carbohydrates are complex molecules of polysaccharides such as starches in wheat, rice, cereals, and pulses are converted into monosaccharides known as glucose. Sucrose, that is cane sugar, is converted into glucose and fructose. Milk sugar, that is lactose, is converted into glucose and galactose. Maltose, that is fruit sugar, is converted into glucose and fructose. Digestion of starch begins in the mouth, that is the salivary enzyme amylase converts 5% of the starch into maltose. Enzymatic activity is halted in stomach due to its high acid content. In duodenum and jejunum, Pancreatic amylase enzyme converts carbohydrates into maltose and other small glucose polymers. The villi, that is the very small finger-like processes projecting into the small intestine, converts lactose, sucrose and maltose, that is they are disaccharides, into monosaccharides, glucose, fructose and galactose. The latter are absorbed in the villi and passed on into the blood via the portal venous system, that is the blood vessel network connecting the intestine to the liver. Sucrose is a disaccharide which is a combination of 50% glucose and 50% fructose. Fructose, that is fruit sugar, is a monosaccharide which has minimal effect on blood glucose. It is 1.73 times sweeter than sucrose, that is cane sugar. Fructose does not trigger insulin production by beta cells of pancreas. Fructose does not require insulin for its metabolism. It is a natural sugar substance. It is a highly effective sweetener. It causes only slight increase in blood glucose levels. So, fructose containing fruits and vegetables and fructose sweetened foods can be taken in moderation. Energy value, that is the calorific value of some common fruits. Mango for 100 grams, calories 60, sugar 14 gram, of which fructose is 9 gram, glucose 3 grams. Banana for 100 grams, one big size or two small sizes, calories 90, carbohydrates 23 gram, sugar 10 gram, fructose 5 grams and glucose 5 grams. Pineapple of 100 grams, fructose 2.1 grams and glucose 1.7 grams, rest is water. Cereals. The energy value of wheat is 100 gram dry weight, 350 calories, whereas rice is 347 calories, brown rice. Artificial and other sweeteners. Aspartame, trade name NutraSweet, not heat stable and hence cannot be used in cooking. Saccharin, that is sweet and low, sucralose, that is Splenda, acesulfame potassium, sweet one, are heat stable and can be used in cooking. Common symptoms of hypoglycemia. General symptoms: sweating, trembling, pounding of heart, hunger, anxiety. Those related to nervous system: confusion, drowsiness, speech difficulty, inability to concentrate, incoordination, irritability and anger. Non-specific symptoms are nausea, tiredness, headache. Emergency treatment of hypoglycemia. Self-treated if symptoms are mild. 1. Drink glucose 2 to 3 teaspoons dissolved in water or glucose tablets or confectionery, they are sweets, followed by a snack containing starch like porridge, kanji. If hypoglycemia is severe, hospitalization is necessary. If patient is conscious and able to swallow, give oral glucose as drink or sweets, about 5 tablespoons of or 25 grams in drinking water, or apply glucose gel, jam or honey to buccal mucosa. If patient is unable to swallow, intravenous dextrose should be urgently given.